This was the fifth and the last case of the day yesterday. And as you see here, patient has a quite significant degenerative disc disease. And what you see here is the content of the disc that is decomposing inside of your body, but outside of the disc, which is pushed out. And here in the axial CT, you see as well that all this material here is actually the content of the disc that's coming out there. So patient has stenosis, especially in the lateral recess, and corresponding symptom in the L5 and S1. But specifically, this pain has significant back pain. The back pain is not coming from this part here. It's coming from bone, grinding the bone. And certainly the options are decompression or decompression with fusion. Decompression alone is very effective if the leg pain is predominant, but if the back pain is predominant, you have to make this bone stop grinding the bone. And that can be achieved only with fusion. As well here you see that the joint or the facet in the back as well in a bad shape. So we decided on a fusion. And this can be done open old-fashioned way with cutting the lamina and cutting the facet to get in, removing everything. Or it can be done from front, cutting the abdomen, go through the belly, pushing the organs to the up or to the side, and then getting the bad disc out and putting a space in. But the end of the result would be that we increase that. With the transkambin OLLIF, we do all of that minimal invasive. It's small incision, and we lift it up. And our experience is that most of patients, once we lift it up, the problem with the pressure on the nerve and the stenosis goes away. And I have a testimonial from this patient. He woke up and the radiculopathy was gone. And I have 1,000 testimonials to attest that. Many of our surgeon colleagues are going to dispute that you can really do anything but cut the bone and cut it directly out. They call it direct decompression. We call our procedure anatomic and physiological decompression. These are the pictures of the surgery itself, at which we start with the orientation. I want you to see that we start the surgery yesterday at 6:56 p.m. or about 7 o'clock, where we put a K-wire in, get some bone marrow from the bone for soak our biologic in patient's own bone marrow. And then we enter the disc here. As you see, we enter the disc. And then I want you to pay attention that once we enter the disc with the dilator, how it sucks air in, because that space is now bigger. And then after doing a discectomy here, we put a cage in. From the start until the cage was in, it actually, you remember that? It was around 7 o'clock. Within the first 5 to 6 minutes of the surgery, the cage is actually in place. And then we put screws, first obviously the K-wires, and then screws in L5 and S1. And if you look carefully here, you see that the space is completely open now. The foramen is open, the disc, interdiscal space is increased, and the cage is in a perfect position. And then we put a rod in and lock the rod here. This needle that you see here is I give always an epidural steroid injection after the surgery. So, and these are the finals. So this patient actually woke up, the leg pain was gone. I actually got the testimonials. Patient is ready to go home less than 12 hours after the surgery, and is very happy. The previous pain is gone. Patient has been ambulating. If you see here, at 7:17, less than 25 minutes after we start the skin incision, the surgery is already done. Our blood loss was barely announced, and so this has been really revolutionary in ambulating the patient soon after the surgery and send them home within 12 hours actually. First, I would like to ask you permission to use this video for educational purpose and on internet.
Just fine.
So tell me about your symptoms before the surgery first.
Well, I always had pain down my leg, and leg was always cold.
Okay.
So I carried a hot water bottle. Every place we went, I had a hot water bottle if we stayed overnight someplace or whatever. And every night watching TV, I was sitting on a hot water bottle.
Yeah,
in fact, I ruined 2 of them. I blew them out by sitting on them.
So how long did you have that pain, and how bad was the pain, 1 to 10?
Well, it used to be just about
10?
at least 8.
8?
Yeah.
Okay. Now, and you know, obviously we did all the conservative therapy, you weren't getting better, and we saw that the bottom disc in your back was practically gone. Bone was on bone, it was moving the wrong way, and it was pushing on the nerve, so that was a real pain.
Okay.
We did the surgery just yesterday.
Right.
Okay. Now,
Late yesterday.
late yesterday.
Yeah.
Yeah, it was you were my last case, so it is barely 12 hours since the surgery.
Right. I was, well, it's 7:28. And when I looked up, when I woke up, it was exactly 9 o'clock last night.
Now, your surgery actually took me, my part took 25 minutes. That's all what took me, my part, from beginning to the end. Wow. And our blood loss was 56 cc, meaning like less than actually 2 ounces. They were about 2 ounces. And so how are you since then, since the surgery?
Well, right now, no pain at all. I'm just tight, you know, it's tight.
Yeah, we did a surgery. We replaced the disc with a spacer. We put 4 screws. So you got a big surgery. You got a fusion surgery. Okay. Now, since the surgery, has the leg pain come back yet?
No, not
so that's gone.
Right.
And how is the ambulation? How is walking going?
Well, in fact, I really surprised the girls. They said do a barrel roll and we'll help you. And they kind of like, I can't keep up with you.
Yeah.
You know what I mean?
Yeah.
And I was just a little tippy there at one spot. There, but other than that, so far, pretty darn good.
Excellent. Now, well, the plan is, you know, getting you, you know, showing you how to walk, doing physical therapy, showing you some exercises, and most likely go home today. Do you feel you're ready to go home today?
Right. I do. I do very much.
Okay.
At this point, I feel remarkably good.
Excellent. Excellent. Well, you know, obviously you got a big surgery. We still have to go through the healing process, but this result are almost unbelievable after open old-fashioned surgery. These people do not look like you after open old-fashioned surgery. But you know, we could do the surgery because we did that OLLIF, transkambin OLLIF procedure, and we could minimal damage on the way of getting the actual job done. That's why my patient always look and seem like you're in vast majority. Obviously, you know, every person is different, but that's how it goes. Well, any question?
No, I'm just fine. At this point, I'm pretty darn good.
Excellent.